Thank you, Professor, for the introduction. Once again, 早安 and 你好, which means bonjour and how are you in Chinese, right? So we welcome you to Asia. Being the only Asian Chinese here, I'm privileged, and I salute all our European big brothers, and also with my Korean friend that I just met, distributor. We hope to bring diamagnetic therapy to Asia. In Asia, there are not many centers using. I think only Malaysia started 2013. There's a center in Hong Kong, and in Singapore, I'm the only center using it now. Well, we started diamagnetic therapy just as an introduction in 2016 with the CTU-18 and 2018 with the CTU-20. We have 2 machines in our clinic, and we have treated over 1,000 patients with various MSK conditions: knee pain, hip pain, back, shoulder, neck injury, arthritis, tendinitis. We have an aging population in Singapore. This is very common. Every day we see about 60 to 80 patients a day. And just to summarize the background of our review, we have treated a patient with hip pain. We analyzed 64 patients from 2016 to 19, and overall, according to our previous speaker, also a VAS response about 70%. In our clinic, we combine the treatment with diamagnetic therapy, with injections and pharmacology as well. For patients who do want injection with HA and other things, then we recommend them for treatment. So with knee pain, we have treated over 280 patients, and we have a poster outside. You can look at it later. And neck pain is very common, especially during this COVID period. Many working from home. We have about 150 patients treated, and 80% of them gave some improvement in pain and quality of life. And this is in combination. So today we are focusing on the role of diamagnetic therapy for fracture pains and the effectiveness of electrical stimulation and pulse electromagnetic therapy field stimulating the bone healing has been reported for many years. And the CTU machine has a unique feature of high intensity magnetic field of 20,000 joules and can be efficacious for fracture pain management and bone healing. And I have 2 posters outside on the successful use of diamagnetic therapy for vertebral fracture alone using diamagnetic therapy. And she didn't want any other medication injection, but she responded well after several treatments. And we have another patient example outside as well. So in Singapore, we have an aging population, and Singapore has a very high prevalence of osteoporosis. And among the Asian countries, the highest incidence of hip fractures. And every day we see patients with fracture, and this is our own experience that we share. We use the CTU-20 fracture protocol for our patient with pain control, 70 joules, 5 hertz for 5 minutes, the bone power 10 minutes, and liquid movement of intra 80%, extra 100%, 5 minutes. So a total treatment of about 20 minutes per treatment session. So we report our recent experience using the diamagnetic therapy in the recent 5 patients. Beginning of this year, we have treated several patients before, but this time we just present the latest 5 patients. In our clinic, we combine the treatment with medication, injection, and also we have the MBST therapy also that we use MedTech from Germany in complementing our patient protocol. So we have injections in our clinic with romosozumab for bone healing. We give supplements, calcium, vitamin D injection, vitamin K, and also we use diamagnetic therapy. And some patients, we use the MBST therapy also for fracture healing. So these are the 5 patients I'd like to present and share with you today. The first patient is a 66-year-old Chinese lady. In February this year, she fell while walking shopping. She fell on her left arm, severe pain and tenderness, and she had an X-ray which showed a fracture of the surgical head of the left humerus. She did not want any surgery to be done, and she came to our clinic. We gave her CTU therapy consecutive for 3 days with vitamin D injection and sub-Q romosozumab injection. And after a week of therapy, she said she had no more pain. The hematoma also resolved. So she had very good outcome with the CTU therapy in combination. Our second patient is an Indian patient, 64-year-old Indian lady with diabetes, knee arthritis, spine arthritis. Again, she fell while she was walking, and in April this year, she had the left foot swelling and pain. Actually, she showed a fracture of the left foot metatarsal. And we also gave her CTU therapy consecutive for 3 days according to the protocol, and similar injections for vitamin D, because many of our patients, 90% are low in vitamin D, and that's one of the risk factors for fracture as well. And after a week of review, she was very happy. She said, "Doctor, I have no more pain," and she could walk normally. And so that was another good outcome. The third patient we have is a special patient. It's a 63-year-old Chinese lady. She has childhood polio from birth, and she's wheelchair bound. And you can see how did she fall Well, she hit her left toe when she was going on a wheelchair and against a metal pole. She had a severe laceration. One morning, she came to my clinic crying, and the blood was dripping on the floor. I said, this is too serious. I have to send you to the hospital. X-ray showed the fracture of the left first toe proximal phalanx. And after surgery, she came back in severe pain. We gave her CTU therapy, and that helped to relieve the pain. You can see the severe laceration of the toe. Although she has a small leg from polio, she still had a Y-shaped laceration. The hospital did the suture, and the X-ray showed the fracture of the proximal phalanx. So this is our setup in our clinic, and she's on a wheelchair, and her little toe is there receiving the CTU therapy. And she came in with a VAS score of 10 upon 10. She said, "Doctor, I'm severe pain. Can you help me?" After the first treatment section, the pain VAS score became to 1. Of course, the pain came back, and she completed 7 sessions of treatment. The analgesic usage has been reduced. Now she's much better. She can move around in a wheelchair with hardly any pain. And also, I believe the CTU therapy helped in the wound healing. The wound was quite a lot of suture, you can see. And after together with the treatment for the bone, I believe the wound also healed and all the stitches were removed without any wound breakdown. The 4th patient that we have is a 85-year-old Chinese lady. Our Singapore population are living to 80, 90 years old. My father is 85 years old. He's helping me with the rehab next door in my clinic. So this lady with a background osteoporosis, OA knee, OA spine, she was walking in the kitchen and she tripped and fell. Her left foot was pain and swelling. She came to see me. X-ray showed a fracture of the base of the 4th and 3rd and the proximal phalanx. She could only come for therapy once a week because her son could only bring her once a week. So we gave her CTU therapy once a week, together with injection, vitamin D, romosozumab for patient osteoporosis, has been shown to help with bone healing. After 1 treatment with CTU, she said, my pain is better. I just saw her last Saturday before coming to Switzerland, and she could now walk normally after 4 treatments once a week of CTU 20 therapy. So that is another good outcome. The last patient is a 52-year-old China lady. She had a history of osteopenia. She fell from a chair and the left arm was in severe pain. She could not lift her left shoulder. X-ray showed a fracture of the head of humerus. She was seen in a government hospital, and they said nothing can be done. You just go home and rest. A friend recommended to my clinic. We did an ultrasound, which I'll show you later. And we started on CTU therapy, 6 sessions for the fracture of the shoulder, and the VAS score improved from 5 to 3. The range of movement also increased from less than 90 degrees to more than 120 degrees. Of course, we gave her shoulder injection as well. This is the ultrasound that we do in our clinic. We can see the arrow pointing to the break in the cortex of the bone, the greater tuberosity of the humerus. And also, she had also, because of the fall, bicep tenosynovitis with a Doppler signal, and that was also treated with injection and CTU as well. So she just did an X-ray last Friday on a visit, and the X-ray showed that the fracture is already healing now with sclerosis over the greater tuberosity. So in conclusion, I think CTU diamagnetic therapy is a useful adjunct therapy for various musculoskeletal conditions, as we have heard in our various speakers. And in terms of fracture management, I believe it's also a useful adjunct therapy to alleviate fracture pain and tissue swelling in the acute phase, and also to promote patient recovery, pain relief, and early mobilization, in addition to the conventional fracture treatment that we give to our patients. So I think there's a great role that CTU can play, especially in this time when patients are old, osteoporotic, and frequent prone to falls. So I believe CTU 20 can help in many of our patients with fracture pain management. Thank you very much. Grazie.